Great, thank you, Anthony, and thank you, CPS, for having me today. Appreciate the opportunity. My name is Jeff Romano. I work for VPL as the AVP of Enterprise Alliances, and what that means is I work with organizations like CPS, technology companies, GPOs, and other organizations that are in the pharmacy space to help them understand what our product offerings are for pharmacies. Prior to working at VPL, I worked in specialty pharmacy for a couple of years in health system specialty pharmacy at Trellis RX. I worked for a couple of years as a pharmacy director and spent many years in retail pharmacy in managed care, purchasing, and 340B management. So I'm excited to talk to you today and share some of my insights and some of the insights of our customers on how to avoid distribution errors and prioritize patient safety. Our agenda for today will start with distribution errors and safety concerns, and I'll go into some of the causes of distribution errors and why there is a prevalence in distribution errors in the pharmacy space and why that problem is actually increasing and not going away. And also talk about some of the safety concerns, both from a patient perspective and also from a safety on the product flow perspective. We'll talk about why generic software isn't working and why maybe the software that you're utilizing today to ship products out of your pharmacies directly to homes aren't the best solutions. We'll talk about the benefits of clinically minded workflows and why a product that's designed for pharmacies for shipping is probably the best bet for you, your patients, and patient safety overall. And then we'll have a couple of minutes at the end where we'll do some Q&A. So please, as Anthony mentioned, please feel free to send those questions through the chat box. So the problem as we see it is generic software. And we say that because what's happened, certainly with the prevalence of specialty pharmacy, and then throughout the pandemic, as more and more pharmacies decided to ship patients medications directly to their homes, was that they were looking for an easy or quick to implement software solution to ship patients products. And what that meant was going to a website or getting an off-the-shelf product that moved product from location A to location B without necessarily thinking about some of the other nuances that are particular to pharmacy. And some of that could be back-end reporting, some of that could be some of the requirements that we have for accreditation. And we'll go into that in detail here in the next few minutes. But it's important for you to understand that the problem as we see it again is that the software that you may be using today is not necessarily solving all the problems that you have and certainly not contributing to patient safety. So URAC actually conducted a study, and for those of you not familiar, URAC is actually an accreditation body that is specific to specialty pharmacies. They actually did a study a couple years ago that they found out that 2 times more errors were reported in distribution than in dispensing. Now, if you think about it, all of the work that goes into the process of getting a medication ready to print the label, that's all the clinical intervention, that's all the prior authorizations, all of the patient assistance that goes into it. Once you get it to a point where you print the label in the pharmacy and then you ship it out, you're actually at risk of 2 times more errors happening in that process than all of that other stuff combined. And certainly it leads to patients not getting their critical medications. And then worse, patients have readmissions to hospitals. They could have deteriorating disease states. There are a whole host of things that could cause untoward effects if patients don't get their medications in a timely manner. Now, what we've seen throughout the course of pharmacy and its evolution is that dispensing, patient management system, pharmacy management software, they've evolved. They've helped us create better workflows to increase patient safety. However, the distribution end of this process has for the most part been ignored. So what we haven't been able to do is integrate some of those processes to increase patient safety and efficiency within the pharmacy. And quite honestly, the problem's not going away, and really it's growing. And this is probably no surprise to anybody in healthcare, but our population is getting older, and that's a great thing. We've built out and we work with medications now that prolong life, that increase quality of life, and we see this population of adults over the age of 65 really growing over the next few years. And you also see this prevalence of at-home healthcare, 61% growth in the pandemic alone. And I'm sure many of you have seen that within your own health systems or your own pharmacies, where more and more patients are receiving specialty pharmacy medications or at-home infusions or even their retail medications being delivered directly to their home. And again, as the population starts to get older, you start to talk about more and more chronic disease. Currently, 60% of the US adults have at least one chronic condition. 40% of those have 2 or more. And as the population ages, you're going to see more and more patients with complex, multiple disease states that need additional management through pharmaceuticals. You see that as well in the pipeline of pharmacy, is that most of those medications now are biologics or specialty medications. So they're going to have to be routed through specialty pharmacies, and more than likely, they're going to be needed to be delivered directly to the patient's home. So as more and more patients are going to be needing more and more medications, particularly in the specialty realm, the problem of distribution continues to grow, and we need a solution that will help us get the patients their medications safely and accurately. So generics, as pharmacists, we love generics, right? Low cost, high efficacy. We think it's a great solution for our pharmacies and for our patients, but it's not a great solution for software when it comes to managing our patients. There's a lot of challenges with standard shipping platforms that were certainly not developed with healthcare, pharmacy, or clinicians in mind. There's multiple systems and workflows. You might have to go to multiple websites to manage different types of carrier processes that you utilize, or you might only have one particular carrier that you utilize because of contracting through certain mechanisms through the hospital. You may or may not have a courier option, and if you do have a courier option, it may not be tech enabled, so you don't have visibility once the package leaves the pharmacy. There's really no cost over, or no control rather, over cost optimization. So more of kind of what you get is what you get. And then there's really no insight. So you don't have a partner in this process. You don't have a business partner that is helping you improve what you're doing for your patient from a cost perspective, but also from a patient safety perspective. So you want to work with a partner that's going to listen to you and work to improve those processes overall. And what we've done is we've broken it down into 4 different buckets that are critical, and certainly we'll focus on safety, but a lot of these have components within safety. So we'll talk a little bit about each one of these buckets in their own right. And we'll start with safety because that's why we're here today. And at its very least, safety can be challenged from a distribution standpoint, because when you finish the prescription and a label prints, you may have to take that label to a third-party vendor website and type in the patient's information manually. Certainly not ideal when there's a risk for transcription errors, when it's time spent that could otherwise be used managing patient care. Without automation, or including multiple systems and workflows, there's inherently a problem there from the very beginning that the information from the pharmacy system doesn't get put into the distribution system accurately. There's visibility challenges. Certainly, by not utilizing an integrated system, you could have a wrong address. You could have late, failed temperature shipment issues. And all of these become a challenge for the patient because they're confused about where their medication is, when it should be arriving. Do I need to be home? Do I need to sign for it? So those challenges complicate the issue. From a pharmacy perspective, again, you talk about some of those pharmacy-specific things that we have, and you think about compliance issues. Are there gaps in the reporting that you have to have for accreditation in specialty pharmacies? Do you have the information necessary to help you make good decisions in the pharmacy? Are you able to provide proof of signature, proof of delivery that has a tie to a prescription number for a payer audit, so that when they come in, the risk of clawbacks is significantly reduced and you have all the documentation required? And then cost in general. Certainly in health system pharmacy and specialty pharmacy overall, you're talking about a huge amount of risk on the distribution end of the process. So whether it's at the very beginning of the process as you're selecting the most cost-effective mechanism to get the medication to the patient, or you're talking about manual invoicing, you're talking about rescue. If you lose a specialty medication or medication becomes spoiled, huge amount of risk there, particularly for health systems that may be not-for-profit 340B, where you're able to purchase medications at significantly reduced costs and have to replace that medication if it was lost or spoiled at a retail cost. So significant costs could be impacting the system, and all of that lends itself to challenges with patients getting their medications in an effective time. So we have one of our health system partners, Mark, who works at St. Luke's Health System, and he's been working with us for quite a while, and we captured this quote, and I'll read it to you. The ideal solution is a mix of services, all deliveries managed within one site, and protection from audit risk. And I think that really captures what we're trying to do here, and that's give a solution to the pharmacy teams that works well for you, that works within your processes, that gives you clear visibility and also protects you and has the information you need necessary to answer audits or other compliance challenges. So let me talk a little bit about the solution, and the solution really addresses some of the same challenges that we talked about a little bit earlier. And our particular solution is called TrajectRx. And what I would challenge you to do is certainly listen into some of the things that our product satisfies, but also I think about as we go through these, is the product that you're utilizing, are there challenges or are there opportunities there where maybe there are some gaps? So I think it's a good opportunity to sort of weigh in on what you're thinking your current shipping solution offers, and maybe there's an opportunity to think about something that might work a little more better and more specifically for pharmacy. So our product is a clinically minded and quite frankly cost-effective, cost-conscious shipping, tracking, compliance solution specifically designed to modernize your outbound pharmacy operations from start to finish. I think I mentioned earlier, but if I didn't, VPL was born out of health system logistics. So we started about 12 years ago, and what we did is we worked with health systems to help them manage their inbound, outbound freight and their logistics. And what we heard over the last couple of years as the prevalence of pharmacy to home shipping started to surge a bit was that our pharmacies didn't have a great solution. And we had some things built from an outbound shipping perspective for the health system in the hospital, but it wasn't really catered to pharmacies. So what we did is through a team of pharmacists and through insight from our partners, developed a product that we feel meets the needs of pharmacies in particular. So how are we helping solve some of these critical issues? And I'm using some of the examples because it's obviously familiar to us about what our software does, but certainly these are the questions that you should be asking yourself if your current software or current vendor helps you manage and mitigate some of these challenges. Number one, again, primarily our issue today is how do we increase safety? So the first and foremost is we automate. We integrate with many different pharmacy management systems to get the patient information and the prescription number into our distribution software so that that information flows seamlessly into the process. We also have an address verification tool so that when you input the information and when that information is imported from the pharmacy management system, we actually do a double check through the process of address verification to ensure that the address is correct from a postal code standpoint. That helps, again, reduce any errors. You don't get mixed up between, street northeast, street northwest, things along that line, and we ensure that the correct address is on the patient package. We also do workflow consultation. As I mentioned, we have pharmacists on staff and technicians on staff, and you have a dedicated pharmacy success manager that helps you manage your workflow, and not only from a front-end workflow consultation standpoint to make sure that we're doing everything to increase and optimize safety, but also on the back end to make sure that if you do have challenges, whether it's with the front-end safety or otherwise, but if you're having challenges with your carriers or couriers, we offer that consultative services and intervene on your behalf to make sure that we're giving you the most effective partnership that's possible. And then you talk about visibility, and I think visibility is a really key component of safety as you start to think about how do we make sure that the patient and the pharmacy has a good understanding of what's happening with their medication delivery. So we have very clear track and trace functionality from a carrier and courier, tech-enabled courier perspective. It helps the patient understand when the medication has left the pharmacy, what's the status of the medication, when the patient has to be home for a signature, and when a medication is ultimately delivered to the home. We work through all of the major carriers and couriers to make sure that we have really good delivery confidence, that when you select when a package needs to be there, that the information you receive back and ultimately the selection and the modality of shipping that you choose has a high level of confidence that the medication will get there when it needs to get there. And we do a number of different delivery notifications, as I mentioned, via email, via text message. I think it's very important that the patients become a partner in this process. It not only helps them become accountable to make sure that they're managing their medications effectively, but it also allows them to self-manage, and that frees up time at the pharmacy so that your teams can do more on patient management, patient care, clinical work, and increasing the overall safety and effectiveness of the care that you're delivering. And then compliance, we want to make sure that we're helping you with improving your trends. You're doing right by your customers, and you're also doing right by the pharmacy to do what's most safe and most effective. We have a separate storage and facility that manages all of the proof of deliveries, all of the shipment notifications, so that if you ever need that information, all you have to do is click on the link that we provide in the software, and it gives you proof of delivery and all the information about delivery up to 10 years. And we know that's important because of Medicare audits can go that far back. So it's really important that you have a solution that is easy to get to and also has all the information. Many of the large carriers only provide that information for 90 days or 6 months, and then the information is purged from the system. So it's important to have a partner that's providing that information to you on an ongoing basis to ensure you have access to that information when and if you need it. And then exportable metrics. Again, as you talk about accountability, and as you talk about accreditation, many of the accreditation standards are now including distribution standards. And in fact, URAC 5.0 has a mandatory requirement on distribution accuracy. It also has some other requirements on patient notifications. So it's important that you have something that you can easily get to if you have to answer an audit, if you have to respond to an audit, either you're creating or you're engaging for the first time in the accreditation process, or you're getting renewed every few years. You have those metrics available to you in a real-time basis to provide that information in a manner that's easy to get to. And then again, as you talk about costs, many of us have really great rates, whether it's through a GPO, a state or local not-for-profit type rate. But whatever those rates that are best, and VPL actually has some really great contracts as well. Whatever the rate is that is best for you, those contracts are loaded into the system. And whatever we present you with a mix of services and service level optimization. So not only are you picking the best carrier or courier, but you're also presented with the right service level. So do I need to ship overnight priority, or can I ship 2-day ground because it's going to get there in the same amount of time? And while this may not necessarily seem a component of safety, as your team spends less and less time figuring out what the best mechanism of shipping is, they get to spend more and more time on patient care and overall increase in safety, and they can manage some of the challenges that you have maybe further upstream and or downstream to make sure that patients are getting the medications, the right medication at the right time. So it's really all of these components have some factor in safety, because what we try to do is take away the decisions that are not necessarily critical to the process, but very important to the process, and making sure that we give your teams back time to practice at the top of their licenses. And how it works, it really works by integrating all 4 of those components into a process that works well for your team and provides consistent processes that are easy to follow. You have an integrated dispensing patient management system into your distribution system, into your shipping system. All of those courier and carrier rates are presented to you in a real-time scenario to make sure that wherever that product is being shipped from and shipped to, and however you need it to get there, you're picking the best rate for that delivery. We have alerts and communications, whether that's notifications or emails, to make sure that your patients are aware of what's happening with their package, and they are as part of the process, as well as your own team. They get the alerts as well, so they know if something gets delayed. Several of our customers have said that they look into their shipping queues either end of day or beginning of day, and they look at the exceptions, which are great because they can see either packages that are still out for delivery or packages that are delayed. And they can actually be proactive in engaging customers where there may potentially be delays, to make sure that they don't have to worry about some type of recovery effort that they wouldn't necessarily have to have otherwise. And then shipping history and compliance, making sure you have all the data available for compliance audits, for accreditation standards, and that all of that information is available to you in an easy to read format, an easy to access format, and it's all automated as best as possible. So what's important, as I wrap up here in the last few slides, I want to make sure that I sort of focus on the things that are most important. It's important that you're provided with a mix of carriers and couriers that will give you the most cost transparent, highest level of control, and those choices that you make and the selections that you make for your pharmacy, for your health system, and for your patients, you're confident in those selections that the medications are going to get to the patient when they need to get to the patient, and you're spending the least amount that's possible to ensure that deliveries are there when they need to be there. Talk about comprehensive visibility and compliance, and this is a mock-up, but it's not too far from what we show, and it really gives a good example of the tools that we present in our software, and certainly tools you should have at arm's length, where you can click on tracking numbers, you can get the details behind the prescription, and all of this is stored within, for 10 years. It'll show you the status of prescriptions, and all of that should be able to be sorted so that you can see packages that have been delivered, packages that are at risk of not being delivered. And it really helps your team focus on where there may be the highest amount of problems. And again, saves time, allows them to work at what they need to be working at from a clinical standpoint. Also very important, as I mentioned earlier as well, is you mitigate the very costly, very expensive package rescue. So the intent there is that if you can prevent that from happening, prevent a repurchase, prevent a reshipment, that's certainly top of mind, and certainly what we hope to help you accomplish from a partner. And then operational automation and optimization. We want to make sure that you have all of the tools necessary to make great decisions for your patients, great decisions for your health system, and that you have the tools and information available to you in a real-time basis. And also have the support from a team, as I mentioned, a customer success manager, a team that understands pharmacy, that understands some of the challenges you have, and understands when this is critically important to make sure that these processes go off flawlessly so that you can ensure that medications are safely delivered to your patients. We want to make sure that we integrate as best we can to streamline that workflow, spend time where it's important to spend time, and not spend time on the shipping side of the business. it's important for you, and I put up here just a couple of partners that we have. It's important that you work with a vendor from a shipping perspective that is willing to work with multiple partners, multiple pharmacy management systems, multiple patient management systems. And this is important because the more integration you can have in your process, the less risk there is for transcription errors, the less risk there is for addresses not being correct, and getting the information from one system to the other and using the least amount of systems as possible certainly makes the most sense. We've heard from different customers that they have a separate system from a carrier, they have a separate courier system, they have a separate notification system. It's nice to have those systems that are as integrated as possible, so you have one source of the truth. You can go to that when you need to go to that, and the information is readily available when you need to provide that from a pharmacy management or a pharmacy audit compliance standpoint. So I hope that you've taken away a few points of emphasis that you'd like to think about when you're talking about the distribution end of your pharmacy management system. Certainly, we hope that you think about and consider the solution that we have out there. But what's most important is that you select a process and an operational viewpoint that allows you to have great visibility into the system, that's creating cost-effective mechanisms for you, that is keeping you compliant with any types of audits or accreditation standards you have, but certainly utilizing all of those tools to create the safest experience you can for your patients and for your health system, and ensuring patients get their medications when they need it so that they don't have any issues or have any challenges with their therapy. I thank you for your time. I thank CPS for allowing me to speak here today, and I'm happy to answer any questions you have specifically about our tool and or any of the topics that I covered today.